And gaining weight is a part of being pregnant. It comes along with it. After all, you're growing a tiny human, but many women are confused about how much weight they can expect to gain when they're expecting. Fox Medical Team's Beth Galvin joins us now with some answers. And Beth, good morning. I have to ask you, what's considered normal here?
So the good news is that normal is kind of going to be different, at least for almost every woman who is pregnant. A lot of it has to do with what your weight is going into your pregnancy. So we asked a registered dietitian from Northside Women's Center about what to expect and how to keep your weight on track.
If you're expecting a baby, expect to put on a few extra pounds. Because Northside Hospital Women's Center registered dietitian Lauren Cicinelli says weight gain is a normal, healthy part of pregnancy.
And it's actually a good thing because that weight is going towards your baby growing and developing. It's going towards an expanded blood volume, and it's going towards some stores for when your baby is born that you're going to need.
And the American College of Obstetrics and Gynecology says depending on your pre-pregnancy weight, you can expect to gain anywhere from about 10 to 40 pounds. If you're close to your ideal weight going into your pregnancy, expect to put on 25 to 35 pounds. If you're overweight or even obese, a better target for you may be closer to 15 to 20 pounds of weight gain. And Cicinelli says weight gain is an individual thing, so you want to talk to your doctor, and remember, you're growing a baby.
So we want to make sure that women are focusing on a healthy overall diet. So this is going to be a diet that includes things like vegetables and fruits. It includes some sources of protein throughout the day. We also want to make sure that they're getting whole grains and complex carbohydrates.
Cicinelli recommends that pregnant women limit processed foods or junk foods, which don't really have the vitamins and minerals that their bodies need. And sadly, there's no such thing as eating for two. Most pregnant women need only about 300 additional calories a day. Cicinelli encourages expectant moms to think about the bigger picture, focus on getting a good balance of healthy, fresh food.
If they're making half of their plate vegetables and fruits, a quarter of their plate carbohydrates, and a quarter of that plate lean protein, they're less likely to gain weight.
And some pregnant women are on the opposite end of the spectrum and really have difficulty gaining weight in their first trimester because it's tricky, because they're going through morning sickness and other things like that. Fortunately, most of your weight gain is going to come in the second and third trimester, and that's when you're going to be putting on at least a pound a week usually.
So what are the complications that come with putting on too much weight?
A few complications can happen when you gain too much weight during your pregnancy. One is that the baby can be large, born large. That can raise complications during the delivery. Also, if you put on a lot of extra weight, it's harder to take it off once you're, on the other side.
That is true.
Now you're laughing because you look fantastic, and you said
sweet.
You put on more than you thought.
Oh, I put on more than the recommended amount. But I told you my thing was I stopped looking.
Yeah,
I just stopped looking. But definitely important to make sure you're on track here. But what is the best way to stay on target with that weight
I think
gain?
the first thing really happens in a discussion with your doctor when you're pregnant. About what's going to be my target weight going into this. What are some tips to help me stay on track? That's really going to be the best way. I can't give you a plan to not have, to help you gain weight, but your doctor can.
Important. All about keeping that baby healthy, right?
Fantastic.
I saw you were doing this story and was like, maybe we should have had this story before,
I looked
right?
like you. Yes.
Gosh. All right, Beth, helping us out. Thank you. Time is 7:42, and when we come